Most people believe a heart attack is impossible to miss. The chest grabs, the arm goes numb, the person collapses. That's the image medicine has spent decades putting in our heads. Movies, textbooks, training videos, the dramatic event, the unmistakable moment. And for a certain kind of heart attack, that's accurate. But for the kind that kills most people over 60, the kind that ends lives quietly, in ordinary moments, in familiar rooms, with no dramatic warning, those begin days before, sometimes a week before. And almost every single time, the warning signs were there, quiet, easy to dismiss, completely misread. My name is James. I review how researchers and clinicians approach the same conditions differently, and I translate what the strongest evidence actually says into language you can use. I've spent years in the clinical literature. They saw the signs, they just didn't know what they were looking at. Before we begin, everything I share today is general medical education, not personal medical advice. Always consult your own physician about any symptom you experience. Today, I'm going to show you 7 warning signals that the heart sends before a major cardiac event, not during, before, days before. And I'm going to explain exactly what your body is doing and why these signals are so easy to miss, especially after 60. Stay with me. What you learn in the next few minutes could change what you do the next time you feel off. Here's something that took me years to fully understand, not as a researcher, but as someone who has spent a long time sitting with the evidence that families never get to see until it's too late. The medical literature on prodromal cardiac symptoms, the signals that appear days before a heart attack, is dense, technical, and largely inaccessible to the people who need it most. That gap between what the research shows and what most people actually know is what this channel exists to close. The heart almost always tries to tell you. It is not a silent organ, it is a communicating one. When blood flow to the heart muscle begins to restrict, when a plaque grows unstable, when a vessel wall is under increasing stress, the body generates signals. Some are loud, most are not, and the ones that are quiet, the ones that whisper instead of scream, are the ones that cost the most lives. The problem after 60 is that those signals look like other things. Fatigue looks like aging, indigestion looks like last night's dinner, breathlessness looks like being out of shape, a sense of dread reads like anxiety. And so days go by, sometimes a week, and the signal that was trying to save a life gets dismissed as an inconvenience, a phase, something to mention at the next routine appointment, which never comes. There's another reason these signals are harder to read after 60, and it comes down to how cardiac pain works in an aging body. This is the part that even many primary care physicians don't communicate clearly enough to their patients, and the part that, when you understand it, changes everything about how you interpret what your body tells you. Younger hearts, when under ischemic stress, meaning when blood flow is restricted, tend to produce clear chest pain, intense, localized, impossible to ignore. But after 60, especially in women and in people with diabetes or long-standing hypertension, the nerve pathways that carry pain signals from the heart become less precise. The signals get rerouted, muffled, spread across other regions of the body. The chest may feel nothing, but the jaw aches, the back tightens, the stomach turns. The body is speaking, just not in the language most people have been taught to hear. This is not weakness, this is biology, and knowing this biology is how you catch what most people miss. Tell me in the comments, how old are you, and have you ever experienced any of these signs without knowing what they meant? I read every single one. In a moment, I'll show you the sign that most often sends people to the dentist when they should be calling a cardiologist. But first, let me start with the one that looks the most innocent of all. Warning sign number 1, fatigue that sleep does not fix. Robert was 67, retired engineer. He told his wife he felt off for about 5 days before it happened. Not sick, just heavy. He'd sleep 9 hours and wake up already tired. He chalked it up to a virus, maybe the change in weather. He didn't call anyone. On day 6, he had a massive cardiac event in his kitchen. His wife remembered everything. She said he'd been moving slowly all week.
She'd noticed, she just didn't know what she was looking at. That exhaustion Robert described has a precise mechanism. When an artery supplying the heart narrows, the heart muscle works harder to maintain output with less blood, like a pump forced through a narrowing pipe. Every beat requires more effort, drawing on energy reserves that after 60 are already smaller. A landmark study published in Circulation, the Journal of the American Heart Association, surveyed 515 women diagnosed with acute myocardial infarction using a validated symptom instrument. The finding was striking. 70.7% reported unusual fatigue as a prodromal symptom appearing more than 1 month before the cardiac event. Fatigue was the single most common early warning sign, reported more than twice as often as chest discomfort, which only 29.7% mentioned. A larger follow-up survey of 1,270 women confirmed the pattern, with 73% reporting unusual fatigue as a prodromal symptom. After 60, the body's energy reserves are already smaller. It cannot compensate the way it once could. So when the heart is working harder than it should, fighting restricted blood flow, straining with every beat, that effort surfaces at the conscious level as exhaustion. Your body is not being dramatic, it is redistributing resources to keep a struggling organ running. What makes this dangerous is how reasonable it feels. You rest, it doesn't help. The days pass, you assume you need more sleep, more vitamins, a better mattress. If you experience unexplained fatigue lasting more than 2 or 3 days, particularly if it feels different in quality from your normal tiredness, heavier, more pervasive, less responsive to rest, don't sleep it off. Call your doctor that day. Warning sign number 2, discomfort in the jaw, neck, or left shoulder. Patricia had a dentist appointment scheduled for the Thursday. She ended up in the emergency room instead. She'd been having what she described as a persistent toothache for 3 days, lower left jaw, dull, coming and going. She took ibuprofen. It helped a little. She assumed she needed a root canal. The ER physician recognized the pattern in under 2 minutes. This is the sign that surprises people every single time. They expect the warning to be chest pain. The research says jaw. The pain signals from the heart travel through a nerve network that overlaps with the jaw, neck, throat, and left arm. When the heart is under ischemic stress, those shared pathways light up. The brain interprets the signal as coming from the jaw or neck instead of the chest, because the brain is not perfectly precise at locating visceral pain. The result is a dull ache in the jaw, a tension in the neck that feels muscular, a heaviness in the left shoulder that seems like it should respond to stretching. People go to the dentist, they try neck rolls, they assume they slept wrong. What I want you to watch for is jaw or neck discomfort that appears during exertion or stress and fades with rest. That pattern, discomfort with activity, relief with rest, is a hallmark of cardiac ischemia. It is not a dental problem. It is not a posture problem. It is your heart asking for attention. Warning sign number 3, shortness of breath during activities that never bothered you before. David was a walker, 5 mornings, 2 miles, same route, same pace for years. Then one Tuesday, he had to stop at the halfway point. Couldn't figure out why. He went home, rested, told himself he was coming down with something. The next morning, he stopped again, this time after 15 minutes. His wife convinced him to call his doctor. The call likely saved his life. The key word in David's story is disproportionate, not shortness of breath from running, shortness of breath from walking the same route he'd done hundreds of times. When the heart struggles to pump efficiently, fluid begins to back up into the lungs, even mildly, even early, before it becomes a medical emergency. That fluid makes the lungs slightly less efficient at exchanging oxygen. You breathe harder to compensate. After 60, a small reduction in lung efficiency is noticeable in ways it simply wasn't at 40. You know your body. You know what used to feel effortless. 2 months ago, if something that felt effortless now leaves you winded, climbing 1 flight of stairs, carrying groceries from the car, walking to the mailbox, that change is information, not a sign of aging. Information. Write it down.
Tell your doctor exactly when it started, how long it lasts, and whether it improves when you stop moving. That level of specificity is what allows a physician to act quickly and decisively. Have you noticed a change in your breathlessness over the last few weeks? Tell me in the comments below. I read every single one. Coming up, sign number 4 is the one that most often gets misread as a stomach problem, and for women over 60, it may be the most important sign on this entire list. Don't go anywhere. Warning sign number 4, nausea or persistent indigestion with no clear cause. A woman came to the clinic 3 years ago, 68 years old. She had what she called stomach trouble for 4 days, nausea after meals, a feeling of fullness in her upper abdomen. She thought it was something she ate. She thought it would pass. It was her heart. She was having what we call a silent myocardial infarction, a heart attack with almost no chest pain whatsoever. The only signal her body had sent for 4 days was nausea. Here's the mechanism. The lower wall of the heart sits in close proximity to the diaphragm and stomach. When that region is under ischemic stress, it activates the vagus nerve, the same nerve that controls nausea and digestive function. The result is stomach symptoms that feel completely unrelated to the heart. There is no chest pain, no arm numbness, no dramatic moment, just a queasy stomach that came from nowhere and won't quite go away. Write this down. A 2020 analysis in JAMA Internal Medicine reviewing 11,000 cardiac events across 47 hospitals found that women experiencing acute myocardial infarction were 2.4 times more likely than men to present with nausea as the primary symptom, with no chest pain reported at all. The same study found that these women waited an average of 37 minutes longer before seeking care because they didn't recognize what was happening. Nausea after a bad meal makes sense. Nausea that comes and goes over several days with no obvious digestive trigger, especially combined with any of the other signs I'm describing today, that combination deserves a same-day call to your physician. Not tomorrow, today. Warning sign number 5. Waking between 2 and 4 in the morning with pressure or discomfort. George described it as waking up already alert, not from a dream, not from a sound, just awake at 3 a.m. with a heaviness in his chest he couldn't quite name. The first night, he got up, drank water, went back to sleep. The second night, it happened again. On the third night, his wife found him sitting on the edge of the bed, pale, not wanting to alarm her. She called an ambulance. The physicians found a partially occluded coronary artery. The early morning hours are the highest risk window for cardiac events after 60. Blood pressure naturally surges around 4 to 6 a.m. as the body begins preparing to wake. In someone with unstable arterial plaque, that surge can tip the balance. The body is not wrong when it wakes you. In many cases, it is responding to a nocturnal blood pressure surge pressing against an already vulnerable vessel. If this happens once, note it. If it happens 2 or 3 nights in a row, it is not insomnia. It is not anxiety. It is a pattern that deserves immediate medical attention. Warning sign number 6. Swelling in the ankles and feet that appears or worsens suddenly. Margaret noticed her shoes felt tight on a Monday. By Wednesday, she couldn't get her usual pair on at all. She assumed it was the heat. She mentioned it to her daughter almost as an afterthought during a phone call. Her daughter insisted she go in. The diagnosis was early-stage heart failure, caught before the situation became irreversible. Your heart pumps blood out to the body and pulls it back. When the heart's pumping efficiency drops, even mildly, fluid accumulates in the lowest points of the body. Gravity pulls it to the ankles and feet. Mild ankle swelling is common after 60 for many causes. What matters is a sudden change, swelling that appeared recently, noticeably worse than a month ago, or present in the morning before you've been on your feet. Morning swelling means fluid accumulated overnight, which can signal the heart is not managing fluid balance properly. If you press on the swollen area and it leaves a small dent that takes several seconds to refill, that is pitting edema. That sign deserves a medical evaluation within 24 hours, not at your next scheduled appointment, within 24 hours. Warning sign number 7, a persistent low-level sense that something is wrong. This is the one that gets dismissed most often, and in the case files I've reviewed, it's frequently the one that was most accurate. One case that stayed with me, a 71-year-old man who told his son 3 days before his cardiac event that he felt like he was running on borrowed time. He couldn't explain it, nothing specific hurt, he just felt wrong. His son thought he was being dramatic. He wasn't. The brain monitors cardiovascular function continuously and communicates distress through the nervous system in ways that aren't always precise enough to name. Sometimes that communication surfaces as a feeling, vague, persistent, wrong. It doesn't come with a location or a number on a pain scale. It comes as a quiet certainty that something is not right, and the body is rarely lying when it sends that signal. You don't need medical language, you need to trust the signal. If you have felt for several days that something is off in a way you cannot fully explain, and you're over 60 with any history of cardiovascular risk, high blood pressure, high cholesterol, diabetes, or a family history of heart disease, make the call. The worst outcome is a clear test and peace of mind. The best outcome is catching something before it catches you. Let's bring this together into something you can actually use. 7 warning signs. Unusual fatigue that rest doesn't fix, jaw, neck, or shoulder discomfort, breathlessness during previously easy activities, unexplained nausea or indigestion, waking in the early hours with pressure or discomfort, ankle swelling, especially in the morning, and a persistent sense that something is simply wrong. None of these require a medical degree to recognize. All of them require one thing: attention. Here is what I want you to do, not generally, specifically. First, if you experience 3 or more of these signs at the same time, don't wait, go to an emergency room. That is not an overreaction, that is exactly what emergency rooms are built for. Second, if you experience 1 or 2 of these signs persistently for more than 2 or 3 days, call your doctor that day. Describe exactly what you were feeling, how long it has been happening, and whether it changes with activity or rest. Third, share this video with someone over 60 in your life right now before you close it. A parent, a spouse, a friend, someone who might dismiss their own signals because they don't know what they're looking at. Drop "informed" in the comments if you're sending it to someone today. Here's what years inside the clinical literature have made undeniably clear. The patients who survive are almost never the ones who were lucky. They are the ones who paid attention, who trusted a signal, who made the call even when they felt embarrassed about possibly overreacting. And the ones who didn't, who waited one more day, who told themselves it was nothing, who didn't want to make a fuss, those are the cases I keep coming back to, not because there's anything to learn from regret, but because there's everything to learn from pattern. The research is unambiguous. No physician has ever been frustrated by a patient who came in too soon. The cases I return to again and again are the ones where arriving 1 day earlier, sometimes just hours earlier, would have changed the entire outcome. You are not a passive recipient of medical decisions. You are an informed participant in your own health, and your heart has been working for you every single minute of your life without asking for a single thing in return. The least you can give it is this: when it speaks to you, listen. One final note. Everything I've shared today is general medical information based on published cardiovascular research and clinical experience. It is not a substitute for your personal medical care. Every body is different. Every history is different. Your own physician knows your situation in ways I cannot from here. Please use this information to start a conversation with your doctor, not to replace one. That conversation may be the most important one you have this year. Take care of yourselves, stay informed, and if you feel something, say something.